Ready?
Go ahead.
Okay. So my presentation is on developing FLT3 inhibitors to overcome gilteritinib resistance on the mutant F691L in the treatment of leukemia. So FMS-like tyrosine kinase 3, or the FLT3 gene, encodes a tyrosine kinase receptor, which is involved in the proliferation, differentiation, and survival of stem cells in cancer patients. And that's a picture of what the receptor looks like. And the most common mutation is the F691L on the FLT3 gene in acute myeloid leukemia, or AML. And this mutation causes a high drug resistance and a high risk of relapse in patients who were previously in remission. And AML is very resistant to chemotherapy. It has a median survival rate of 4 months for relapsed patients and an overall cure rate of only 30 to 40%. PCR profiling and DNA sequencing shows recurring gene mutations, but the most prevalent is the F691L. So it's important to find a drug that can treat and prevent this mutation in the future. Leukemia cells evolve to obtain intrinsic resistance mechanisms to drugs, and these mutations often change the shape and overall charge of the protein, and this in turn changes the way the inhibitor drugs are able to bind to the protein, and most of the time they're not able to bind at all once the protein has been mutated. FDA-approved gilteritinib binds and inhibits FLT3 activity, and the wild-type FLT3 docking score is negative 8.5 kilocalories per mole, and the mutant-type docking score is negative 8.35 kilocalories per mole. And these numbers show that the drug is less effective in treating the mutation than the wild-type. The F691L mutation is very common in AML patients, like I previously said, so it's important to find a drug that can treat and also prevent this mutation in the future. So the methodology, virtual screening is able to predict aspects of proteins like binding affinities and docking scores. And it's able to narrow down a large library of drug-like compounds by their top % hits, which is shown in the workflow on the screen. And ADMET is also widely used with virtual screening, and it uses pharmacological properties like absorption and toxicity to narrow down the choices even further. And further lab studies can be done after virtual screening, such as in vivo and in vitro studies, to determine the efficacy of the drug. And virtual screening was not used in the original discovery of gilteritinib, so that's the originality of it. And it's often coupled with structural biology to allow enhancement of discovery by narrowing down lead identification stage, which is mostly the lengthy portion of drug discovery. And it's easy to learn the program of virtual screening. It's quick and it's inexpensive. So the expected results, the IC50 measures the potency of the drug inhibition in inhibiting a specific biological function. In this case, it would be the FLT3 gene, and it's a quantitative measure of inhibitory substance required to inhibit that specific biological function completely. And the new drug should be found, or the new drug found should treat the F691L mutation, and it should have a lower IC50 than gilteritinib, but a higher IC50 than gilteritinib on the wild-type FLT3. The data should show an increase in inhibition on the mutant type, which causes the cancer and the drug resistance. This should be inhibited. And the data should show a decrease in inhibition on the wild type, which is presented in the normal cells or the non-cancer cells to reduce adverse effects of the drug. And the results would verify that the new drug is more potent than the mutant type. And these are my citations.
Your turn. Ask any questions. Your turn. Yeah. Any questions?
What was your lowest concentration?
You mean docking score?
Yeah.
The mutant type was negative 8.35, and the wild type was negative 8.5. So it's more effective for the wild type than the mutant type.
Okay, so my time. So it's good. It's a A type. It's A. Okay, and so the here you have that FDA-approved drug docking to the mutant and the docking to the wild type, and then here clearly shows the drug resistance because the docking score on mutant reduced. So then this you should emphasize this validated Dr. Master because it's consistent with literature. That's it.
Okay.
Okay, good.
Thank you.